at the end of the day, the market to me is sort of in its most generic form, number of patients times reimbursement. And then you've got to start layering on, okay, well, what about access? Who's going to, will the payers actually pay that? Do I need to generate extra evidence to get them to pay for this, et cetera? So we started out from a market perspective doing sort of macro market and then, macro down and then micro up from the patient level. We got so detailed into going into, a number of patients by state, by insurer in the state, by reimbursement, by coverage policy within that state for the CPT codes that we're going to look at. We narrowed down from the US as a whole into which 5 states we thought would be the most beneficial to even start in. So that's sort of how we did it. And then that in those states, the market is X $100 million. We think by putting, these types of resources there, we can capture a couple million, 5 million, 10, you start building it up from that particular perspective. So that's how we really thought about it. It wasn't just the US is a larger market, and it's not actually number of people as we were talking about before. It's actually because the amount the US is willing to pay for what we're doing on a CPT code basis. It's a larger market. And also just like Europe, there's micro markets within it. I think somebody once told me the US is $1,000 billion markets in healthcare. So even for us, well, yes, there's a lot of respiratory patients in the US. California is the largest, state with respiratory patients. It actually doesn't have the best reimbursement policy for what we're doing. So it's not the best place to start. It's something that has to evolve over time. But that's kind of how we, just from a structure, that's how we started thinking about things.
And so you can't think of the EU as one block either, right?
Correct.
I mean, every country has its own reimbursement and so forth. So it's a similar kind of exercise.
Same thing even in the end. So we looked pretty extensively at the NHS, and then you quickly realize that you're not selling to the NHS, you're selling to the different regions within the NHS and the different trusts within the NHS. It's everything. While it seems it's very easy to say this is the macro market, it very quickly becomes a micro market and sub-segmented, beyond that.
And just to layer on top of that, if you don't have an existing code for your product, because you're right, exactly, because you're in like a de novo pathway, right? And so you now have to generate evidence to get a code, to get a coverage determination. So,
well, and it goes back to the original question of which market do you choose. That's the time aspect that most people also need to consider is if there's no reimbursement code, where you can get coverage and payment fastest, regardless of market size, actually makes a lot of sense for a small company.